As we have stated before, we understand that the containment measures come at a cost. They impact our everyday lifestyles and even affect our economic activities, leading to losses. To mitigate some of these challenges and to achieve a balance between safeguarding lives of our people and protecting livelihoods, the government has adjusted and continues to adjust restrictions, including those of extending curfew from 4 a.m. to 9 p.m. and other businesses from 4 p.m. to 5 p.m., thereby allowing for a full day's work schedule. Recently, I did inform you that there were ongoing consultations between restaurant owners and the National Emergency Response Committee on COVID-19 on restaurant hours of business, appreciating that they have indeed been following the rules, appreciating that restaurants have been observing the protocols, and arising out of those discussions and reflecting on restaurant behavior, NAC has directed that the hours of business for restaurants, I repeat, for restaurants, will be extended to 7:30 p.m. This will allow the workers in restaurants, most of whom are actually being housed by the restaurant owners themselves within the hotels, but it will allow enough time for them to be able to beat the curfew hours. The operators are advised, however, that they must adhere to protocols that are provided at the Ministry of Health website, which include, I remind them, having thermoguns at the entrance of the premises to screen clients for temperature, providing hand washing stations and soap at the entrance of each restaurant, providing sanitizers in strategic places at the facilities, including the bathrooms, ensuring that clients entering the establishment wear masks, provisioning for social and physical distancing, even as they sit. And we have also said that all restaurant workers must be tested prior to the opening of any restaurant or prior to the re-establishment of any restaurant. But we have also, from today, changed the protocol that once tested, a hotel or restaurant worker will not need another test in the 14 days that we have been giving them, unless A, the restaurant does not follow the protocols and therefore making it necessary to test their staff, or B, a person shows symptoms of the virus. These guidelines must be strictly adhered to. Public health officials in their respective areas are required to ensure that these guidelines are complied with. They are further required to conduct regular inspection of the facilities, and any operator found not to follow the guidelines will have their licenses and certificates to operate withdrawn permanently. And we will revoke their licenses in accordance with the Public Health Act Cap 242. In addition to that, and the protocols that we have given, we have also said, lest there is abuse by anybody within the Ministry of Health, such action as a revocation, permanent revocation of a license, will be agreed with the Director for Public Health and the Director of the Public Health Directorate. Ladies and gentlemen, Switching to our COVID-19 numbers, we have tested 3,255 samples in the last 24 hours. 133 people have tested positive. This is the number, again, a repeat number of the number we got yesterday. The cumulative number of tests conducted so far is 121,956, nearly 122,000, with a total load in the country of 3,860. All the positive Kenyans, all the positive cases are Kenyans, with 88 being male and 45 being female. This trend has continued throughout the reports that we have made, and we need to understand why so many men are getting this virus. If we were able to drop the number of men to the level of the number of women, you can see that we drop the number substantially. And I think a bit of it has to do with behavior, that women essentially are exhibiting a more careful and more consistent approach to this disease than our men. And I think we as men must also adopt the same attitude. The 133 positive cases are distributed in counties: Nairobi with 86 cases, Mombasa 27, Kiambu 7, Busia 5, Murang'a, Kilifi, Kajiado, Migori 2. In each of those, Machakos and Murang'a County have 1 each. In terms of the sub-counties, Westlands in Nairobi is the lead today with 13, Embakasi with 10, Makadara with 9, Lang'ata 8, Embakasi East and Roysambu have each got 5, while Starehe follows with 4, among other counties that have registered, sub-counties that have registered various numbers. The 27 cases in Mombasa are essentially from Mvita with 16, Kisauni with 6, Nyali with 3. We are delighted to report that we have discharged 40 patients from various hospitals, bringing the total of the recoveries to 1,326. Unfortunately, we have also lost 1 more patient to the disease, bringing the total number of those who have perished and succumbed to this virus to 105. Our thoughts and prayers are with the families and friends during this very difficult period. Fellow Kenyans, today we celebrate the Day of the African Child. Each year, on the 16th of June, the African Union and its member states observe the Day of the African Child as a commemoration of the 16th June 1976 student uprising in Soweto, South Africa, where students who marched in protest against apartheid, inspired education, and were brutally murdered. Yesterday, I spoke at length on the issue of our children's diet and nutrition as part of prevention and promotion of good health in our children, and also as part of building our immunity against this disease, particularly amongst our children. It is important to also address the matters related to treatment and cure of whatever they might get, including COVID-19. To elaborate more on this matter, I have the head Directorate of Preventive and Promotive Health, Dr. Pacifica Onyancha, here with me. She will give details on the ministry's position on child health. And I would like to give her this opportunity to just speak very briefly and explain to you what we are doing as a ministry in terms of pediatric care and our concern for our children. Rest, we think that our attention has been drawn to COVID-19 to the extent that we have forgotten about the other issues. So let me invite you, Daktari, to just speak to that for a minute.
Thank you so much, our CS, for that left behind. To start from where you've left is that as a member of the African Union, the theme for this year's celebration of the Day of the African Child is access to child-friendly justice system in Africa, as adopted by the African Union Executive Council during its 34th ordinary session held on the 7th of August, February last year. The Ministry of Health, in collaboration with the other ministries of Labor and Social Services, has supported various institutions as a way of celebrating this day to give the children institutions child-friendly, to provide menstrual hygiene products as a way of dignifying our girls during this period. As a ministry related to improving child survival, the ministry has continuously implemented high-impact interventions anchored in its policies, strategies, and guidelines. I just want to highlight a few of the high-impact activities that we have been doing even in the face of COVID. One of the high-impact interventions is immunization. Immunization coverage has been affected, of course, during this pandemic, but there are ways of mitigating against this. We know that immunization is a very powerful prevention of child diseases such as measles, polio, and the rest. So having realized that immunization is coming down because of the COVID, we have enhanced IPC practices at the child welfare clinics to make sure that the caregivers are assured of their children coming for immunization without having to get the COVID. We have made sure that the scheduling of appointment is in such a way that we avoid crowding, especially in the public facilities. And also, we have made sure that those staffs who are attending the children in these clinics have their temperatures taken every morning to make sure that we remove, and if anybody having a fever or a cough is not allowed to attend to the children. A second high-impact intervention is promotion of exclusive breastfeeding, and I want to take this opportunity to thank the mothers who are exclusively breastfeeding up to 6 months, as it is in the guidelines. In this phase of COVID, I want to encourage mothers, even when you are found to be COVID positive, to continually breastfeed, but make sure that you are putting on, you wear a mask, and then you have minimal contact with the child, meaning that when you are not breastfeeding, it is good for that child to be taken care by somebody else, not to avoid infection. The other thing is actually we have availed child-friendly formulations for treatment of diarrhea and pneumonia, as you heard that we have to also address the issue of treatment and care for those who get sick. Infant mortality rate is one of the high in our country and in Africa as a whole. We have put measures whereby we have people, healthcare workers who have been capacity built to make sure that they provide working, they are given capacity building in managing the newborn units to make sure that the outcome of the sick neonates is good. And also we have scaled up one of a very high impact intervention called kangaroo mother care for those who are born premature. And lastly, that we use cloexidine in the cord care that reduces infections during this very fragile time. I just want to make an appeal to the mothers in terms of wearing mask in the COVID. Children are very fragile, and I want to say that during this time of COVID, children under 2 years are not recommended to put on a mask because they actually reduce the oxygen supply. The under 5-year children in his personal space, that is in a car, home, should also not wear masks. because this is to avoid suffocation because they may tend to sleep. I'm also saying that health, as our Cabinet Secretary has said, is very key as a form of prevention against not only COVID, but any other disease. And of course, exercises is also recommended. Finally, for those who are taking care of our children, their mental status have to be okay, because if you are not okay, then you are likely not to know how to take care of the children. And therefore, we are requesting that if you feel you need psychosocial support, we have been saying that we have elaborate services to attend to it, and therefore seek help so that you don't injure or affect your child as you take care of them, both the parents and the caregivers. Thank you so much.
Asante sana daktari. Ni kuongeza tu kidogo, niseme ya kwamba wenye mahoteli ambao leo hii tumewaruhusu kuongeza masaa ile wanafanya kazi, wenye mahoteli na wateja wao ni lazima wafuate ile mikakati ambao tumeweka ya kusaidia na kuzuia hii mambo ya ukimwi. Kwa hivyo, sio mambo ya ukimwi wa virusi ya COVID-19. Kwa hivyo sisi tungetimiza ya kwamba wale ambao wanafanya kazi katika hiyo mahoteli, tafadhalini mjaribu sana mfuate hizo sheria, kwa sababu nyinyi ndio mnaweza kuambukiza wale wateja ambao wanakuja hiyo hotelini. Na imefanywa hiyo kitu ni mambo ambayo tumejionea sisi wenyewe. Kama mkikumbuka kidogo, wakati kulikuwa na quarantine mahotelini, kuna hoteli 2 ambazo wafanyikazi wa mahoteli ndio waliumbukiza wale ambao walikuja hiyo quarantine. Kwa hivyo tungependa sana nyinyi ambao tumeruhusu wafanye hiyo kazi, na pia vile wenye mahoteli wasaidie sana, wenye mahoteli umsaidie sana wafanyikazi ndio waweze kufika nyumbani, wasije sana tena tukasema waendelee mpaka saa 1:30, alafu kutoka hapo mnawaambia sasa ni kusafisha, kutoka hapo sasa sijui ni kupika ile ya kesho leo, alafu sasa wanachelewa. Wakifika huko barabarani wanakutana na polisi kwa sababu wamevunja sheria. Vile tumefahamishwa ya kwamba kuna watu wanavunja sheria ya kutoka ama kuingia hapa Nairobi bila sababu maalum. Tumejionea sisi wenyewe juzi tulipokuwa kwenye Nyandarua, wakati wa kurudi unaona magari ni mengi sana. Kwa hivyo tunawaomba hao watu wanafanya hiyo kuvunja sheria, tunawaomba jameni, tunawahimiza nyinyi ndio ambao mtaeneza hii maambukizi ya virusi huko upande wa mashambani. Mkifanya hivyo, tafadhalini tukwamishe hiyo tabia. Vile tunaambiwa ati ya kwamba wale ambao wanatoka Nairobi kuelekea Kago, wale wana Kago, ati mnasimamishwa huko na kule, mnalipishwa shilingi 100 kama toll station. Hakuna toll station ya health. Wale ambao wanafanya hiyo vile hatua itashukuliwa, na hiyo pesa mtupatie ndio tupate kununua madawa na mambo kama hayo. Lakini mtatupatia mkiwa pahali pengine ambapo sio pazuri sana. So I just want to once again thank Kenyans for following the rules. It is because of this adoption of the new protocols, it is because of the adoption of the new behavior that we are able now to continue opening up the economy. We would not be able to open the restaurants if the restaurant owners and those who work in restaurants were not behaving in a manner that they are. We have not noticed any positive cases because of opening the restaurants, because they are observing the rules. Let me emphasize, bars are not open. Bars are not open. We are talking about the restaurants, so that people can be able to get something to eat, even as they head for home, in the event that that is what they wish to do. and also to give a bit of a lifeline to our restaurants and tourism facilities, because we know that they are going through a very difficult time. And we appreciate the sacrifice that they are making. Asanteni sana.
Okay, good afternoon, Waziri. Just a question. We've recorded 105 cases of corona. Yes? Emmanuel Tor from KTN News. Just a question. We've recorded 105 deaths so far. What are the mortality data of these people? What were the underlying conditions before they died? And number two, the medical practitioners have continued to ask for PPEs. Are they just making noise, or they have the adequate PPEs that they are asking for? That's all. Thank you.
Asante sana. Please, if you know the medical person who is asking for the PPE, please send them to me personally. Because as far as I'm concerned, we have given just about everybody who needs a PPE a PPE. Now, let's get it straight. PPEs are not being distributed, just about to everybody everywhere. Even those in the offices here, you're expecting, no, that's not what we are doing. We are giving PPEs to medical health workers who are on the front line and who need them. So if you hear somebody saying that they are not getting PPEs, that is entirely not true. We have enough PPEs in the country, and that's why I'm saying, if you know who specifically, please send them to me, and I'll deal with the issue. All right? And if they tell you that they don't want to talk to me, then tell them, like they say in weddings, forever, let them keep their peace, because it is not true. Now, as far as the 105 people who have succumbed are concerned, we have about 42% of the cases. It is almost 50-50 at the moment, of people who have got other underlying cases, comorbidities of all sorts, particularly diabetes. Diabetes is very heavy on the list of the causes of the disease. Among those with underlying cases, there are also very many cases of cancer. There are also cases of high blood pressure. But we also have people who are not sick before and who had no underlying issues. Yes, next.
Good evening, Waziri. My name is Jane Ngoiri from NTV. There are two senior officials from the Ministry of Health who you have deployed to KMTC and MTRH respectively. What happens should they decline the deployment again? Thank you.
You know, Jane Ngoiri, we have spoken about that issue before. And it is not two officials we have deployed. We have now deployed more than 35 people into various areas and various transfers. As we try to reform the ministry, we will send people to areas where we feel they can be most effective and most efficient. If we didn't think they were good enough for where they were going, then we'd be getting rid of them. But we are not, we are moving people because they must move to where we believe they are most effective and most efficient. Next.
Thank
and
you.
By the way, there is a contract of employment. As I had said earlier a while back, we all have a contract of employment. So your contract of employment says you can work for NTV in Nairobi and you can work for NTV in Mombasa. So if you are deployed to Mombasa and you feel that you don't want to work in Mombasa, then there is a natural thing, normal practice is you give your letter of resignation, alafu you come to the Ministry of Health or somewhere else.
Thank you, Waziri. My name is Abdiaziz Hashim from Ebru TV. Just you have extended the operating hours for hotels. There are hotels in the informal settlements. They're saying some of the measures that you have placed they cannot contend with. The next best thing they can do is place water taps around their hotels so that people can wash their hands. They're saying that it will cost them a lot to take temperatures or test some of the customers that are coming in.
Well, first and foremost, they are not testing customers who are coming in, just for correction. No restaurant is testing customers who are coming in. What they are doing is taking temperatures. And you do need to take temperatures of persons coming in. And we are quite happy to have water taps There's nothing wrong with having, as long as people can wash their hands, we see no reason why that cannot suffice. But I think that at every level, to take every case with its own merit, the easiest thing to do is to work with the public health officers who are there to give the minimum that you must have. Let's not forget, there is a minimum that you must have in order for you to be able to reopen the restaurant. Otherwise, if we didn't do that, then what would happen is that everybody would just open, and then we start the spread of the disease, and that we cannot do. Final one.
Good evening, Waziri. My name is Graham Kajilo from The Standard. My question is with regards to the document that was released by WHO on asymptomatic cases. Yesterday, when you were in Nyandaro, you did mention that people who will be released from hospital who are for home-based care will be tested to detect their viral load. I would like to find out, do we have any specific test that we can use to determine the viral load of COVID-19 in a patient?
Yeah, of course they do. Of course they do, Graham. But I did not say that they will be tested for their viral loads. What we said is that beyond a certain time, beyond a certain period, WHO has proposed about 9 to 10 days, the viral load is low enough for people to be released and they cannot infect others. We, on our part, have adopted a 14-day period, at which point that we will, on conditions, release individuals for home care. I think that the last time we stood here, Dr. Amoth explained very, very clearly what the conditions of being released are. We have also developed protocols for those who will be able to take care of them in their own homes, so that it is something that is managed and guided, even though it is at home, with Ministry of Health support. Community health workers and public health workers are not going to be very far from those families.
My other issue is also around those issues of asymptomatic. Are the new findings from asymptomatic cases the reason why you've decided you'll be testing health workers only for 14 days and no more tests, even if, unless they
it is part of it. It is part of it. It is part of it in the sense that, number one, it is very expensive. You are aware that testing is extremely expensive. Number two, the determination by the health team, even within the Ministry of Health, is that if somebody has tested negative, unless they show symptoms or unless they exhibit behavior that suggests that they might be positive, then there is really no need to test them. And yes, at that point, they will be completely asymptomatic, and there is no cause to cause a test. Thank you all very much indeed.